Hello and welcome back to GP Video Podcast by Nadia. So, if you guys remember, this morning I started talking about smoking and type 2 diabetes mellitus, two monsters that need to be tamed. So, smoking and type 2 diabetes together are a killer combination, and I explained the reasons why is it so. But I also mentioned that smoking can lead to obesity, and obesity is one of the risk factors for developing type 2 diabetes mellitus. So now you guys must be wondering that the common perception is that smokers lose weight, and after quitting smoking, it's actually the weight that increases. Yes, you are right, but then there is a twist to it. And what is the twist? I'm going to explain that tonight. The twist is, so as you know that smoking is associated with a lower body mass index than non-smokers, but smokers are more likely to have central adiposity or male pattern fat distribution. It means fat around the belly, which is again a big risk factor for developing type 2 diabetes. This pattern of fat accumulation is related to a greater risk of developing cardiovascular and metabolic problems like type 2 diabetes mellitus related to obesity, along with coronary artery disease. So those smokers can have lower BMI or lower weight than non-smokers, because what nicotine does is it does suppress appetite, but they eventually put on male type fat distribution, which is along the belly, and the fat along the belly or central adiposity is actually the biggest risk factor for cardiovascular diseases and for developing type 2 diabetes mellitus, then eventually ending in heart attacks, strokes, and multi-organ failure. Nicotine is associated with decrease in appetite and calorie intake, but smoking also decreases the capacity of individuals to perform exercise due to the impact on lung functions. Smoking cessation can lead to increased hunger as a withdrawal symptom, but research suggests that eating patterns eventually return to normal. I have seen a lot of patients who are obese and who are smokers and who don't want to give up smoking because they think that when they leave smoking, of course their appetite will increase and they will eat more and they will become fat. Yes, that is true. That does happen, but then eventually after few months it all comes back to normal and your hunger is back to normal and eventually your weight will fall. But while you are smoking, the central adiposity that you will develop because of that is actually dangerous, is actually a risk factor for developing metabolic syndrome, and metabolic syndrome, as you know, includes type 2 diabetes mellitus, obesity, high blood pressure, and high cholesterol, and also that would lead to cardiovascular diseases and cerebrovascular diseases like heart attack and strokes. And as you know that type 2 diabetes mellitus actually, or diabetes mellitus, whether it's type 1 or type 2, it actually affects all the organs of the body eventually. I would like to again read for you something else regarding this. Many don't quit smoking out of fear they will gain weight. Weight gain is typical after quitting smoking because nicotine suppresses appetite. However, a new study indicates that smoking can also contribute to weight gain. In particular, it increases unhealthy visceral fat. People can avoid weight gain after quitting by changing their lifestyle. Quitting smoking has many potential health benefits. It can decrease your risk for heart disease, lung disease, and many types of cancers. It can even add as many as 10 years to your life. Many people would like to quit but are reluctant to try because they fear they will gain weight. However, according to the findings of a new study published in the journal Addiction, continuing to smoke may also contribute to weight gain, especially the unhealthy weight gain around the belly. The study found that both starting smoking and lifetime smoking may increase a person's abdominal fat. This was especially true for visceral fat, which means fat around the organs, the fat buried in the abdomen. This type of fat is associated with a greater risk of heart disease, stroke, dementia, and diabetes. So while stopping smoking might lead to some short-term weight gain, in the long run, if you don't stop, you could increase your belly fat and put your health at greater risk. So that was the take-home message tonight, and I'll see you guys tomorrow.